So how is EoE diagnosed? Well, you need the combination of both the right pattern of symptoms and the procedure called upper endoscopy with biopsies. The endoscopy is something that seems daunting, but it's a flexible camera that goes through the mouth with the patient asleep, that passes through the mouth and goes down into the esophagus. This allows us to both look directly to the area as well as take the important biopsies, which we can look at under a microscope. And that's where we look for whether those extra eosinophils. Once we do that, the pathologist helps us out, and then they actually count the number of eosinophils in a single standard view. And if they can count more than 15 eosinophils in one standard view, match it with the symptoms, that's how we officially label the diagnosis of EoE. Presently, while many researchers have looked for different ways to follow this condition, we're still stuck for now with endoscopy and biopsies. They've explored blood tests, urine tests, swabs of cheeks and other things, and it doesn't seem to be able to provide the same follow-up that we need to give that actual number of eosinophils in the esophagus. We will, of course, ask about symptoms, but that's not perfect in terms of matching. Some people have lots of symptoms and minimal inflammation, and some people have lots of inflammation with minimal symptoms. So it's one of those things that we need more than just the report. Food allergy testing is a great area of interest. And while there is through allergists skin prick testing or even the blood test, those are still best and most accurate to reflect on immediate type reactions. There is some minimally invasive tests called, for example, one is esophageal string test, where this is a pretty simple string that's essentially put in a capsule, it's swallowed, and then the end of the string is taped to the child's cheek. The string can sit there for as little as 1 hour, and then later pulled out. And then it's not so much they can get the tissue from there, but they can measure proxies or other types of protein that give us an idea if it's active or not. There's also a sponge test where it's a swallowed capsule, and similar idea where something's in the stomach, it expands, the capsule dissolves, and there's a mild, like a stronger sponge that's pulled out. And in that sponge, you can actually both look at the proteins, but also actually get tissue and still look at it under the microscope. These are still kind of being validated, although some groups have demonstrated it works. The last next promising piece, it's not an alternative to scope, but it's a different version of a scope. There's a transnasal scope, which is a much thinner endoscope, which the idea is you can avoid the anesthetic by placing a thin, smaller type scope through the nose with the patient, like more in an office setting, and it's good enough to get the standard biopsies. Even if they're smaller, they have been validated that it can work to at least demonstrate what's going on in the esophagus. So that's something that you'll hear more about in the upcoming months to years.